Patients often come to the orthopedic OPD saying that they have frozen shoulder. I, Dr. Vinayaraj Kelagadi, Senior Orthopedic Surgeon from Kossin, Bangalore. I'm going to explain you what is frozen shoulder, what are the causes for frozen shoulder, and how do you diagnose it and how to treat it. Frozen shoulder is a layman term used for a shoulder condition called as adhesive capsulitis. The two words describe the condition. Adhesive, wherein all the structures around the shoulder are being adherent. Capsulitis is inflammation of the shoulder capsule, which leads to fibrosis and contractures, leading to global restriction of the shoulder movements. Frozen shoulder is a chronic condition, usually because of long-standing inflammation of the rotator cuff muscles secondary to impingement or any direct trauma or degenerative conditions. It is usually seen in females in the age group of more than 50 years, usually commonly associated with diabetic patients and other patients suffering from autoimmune conditions. It's also seen in prolonged immobilization conditions because of fractures or any inflammatory conditions which lead to pain and limitation of the movements. There has been an incidence where it is also seen in patients with strokes and myocardial infarctions. So here, the capsule becomes contracted gradually, leading to adherence and reducing the flexibility of the shoulder joint, leading to restrictions. It can be grossly divided into three phases, wherein the first phase is phase of pain, where there is gradual onset non-traumatic pain, which leads to limitation of the movements and reduces the bone strength. This pain and limitation of movements eventually leads to stiffness, which is the second phase, wherein patients notice that there is gross restriction which affects their day-to-day activities like combing hair, touching their back, or trying to reach out to their pockets in the back, and wearing dresses becomes very difficult. Gradually, it leads to phase 3, wherein there is thawing. Thawing is opposite of freezing. So whatever structures are being adherent gradually starts becoming loosened off and the movements start improving along with the improvement in pain status. Each phase generally lasts for about 4 to 6 months and usually is a self-limiting condition wherein without any kind of treatment and with regular exercises, the condition starts improving over a period of 1 to 1.5 years. A frozen shoulder can be classified as primary or secondary. Primary is where there is no intrinsic or insidious cause which causes this thing and is largely unknown. Secondary cause is if there is any trauma to the rotator cuff muscles or any inflammatory conditions around the shoulder joint or fractures, immobilizations leading to stiffness. Treatment is basically by non-steroidal anti-inflammatory drugs, painkillers, and physiotherapy, wherein aggressive physiotherapy for shoulder mobilization is essential. Intra-articular corticosteroid injections also help reduce the inflammation all around the shoulder and thereby brings down the pain, which helps the patient improving in his movements. When all these treatment modalities fail, the last phase is arthroscopic release or closed manipulation of the shoulder. Closed manipulation of the shoulder in frozen shoulder by far is the best possible treatment modality, and patients are usually happy after these procedures. Here, a patient is sedated or under short anesthesia. The shoulder is manipulated and a sequence of flexion, extension, abduction, and rotational movements, and all the adhesions in the shoulder joint are broken and gradually the movements are improved. Post this procedure, rigorous physiotherapy is very much essential to prevent recurrence. Manipulation under anesthesia is contraindicated in patients with recent healed fractures and osteopenic bone. If you are suffering from any of these conditions, please do visit us and get the possible treatment. Thank you.